we'll talk about Pharma Hermetic products and hair restoration using these topical products. So a little bit about the company first of all. So it's a pioneer of hair biotechnology, and they are based over in Barcelona in Spain. However, they distribute to 35 countries over the world. They're family run, and they've got 20 years of bioscience and pharmacology background behind them before they produce this product. They use 100% sterile organic ingredients, and they specialize in hair care products. So the hair recovery program SP55, which is the range of products that we're going to be talking about, have featured in quite a few different areas of the media. So Platinum magazine, which is a magazine for the slightly older lady, and also Dr. Dawn Harper from Embarrassing Bodies had some positive things to say about the use of the SP55 program. So she said, alongside derma rolling to enhance the growth of hair in the follicle, it's a lot less invasive and less expensive than hair transplant and is growing in popularity. So the hair recovery program SP55. So it consists of a anti-hair loss shampoo, which is for use at home, a lotion, again for use at home daily, and then the vials, which you use in the clinic with a derma roller. 90% of hair loss in men and women is caused by genetic predisposition. And as I talked about earlier, we already know the role of testosterone and 5-alpha reductase is well defined in talking about hair loss. So DHT is synthesized from testosterone, and it's converted using the enzyme 5-alpha reductase, which has been identified as the main cause of male pattern baldness. However, there is also an inflammatory component to hair loss. So at a scalp level, the hair follicle cell cycle can be interrupted with inflammatory cytokines, oxidative stress, telomere shortening, and cellular senescence. Inflammation restricts follicle growth. It decreases oxygen and nutrient supply to the tissues that are prone to alopecia, leads to tissue degradation. Sorry, I can't get my words out this morning. Speeds up hair follicle miniaturization, and eventually the alopecia speeds up. So the hair recovery program SP55, it's cosmetic. So first of all, this opens it up to people that are non-prescribers, which is excellent because it's a cosmetic treatment rather than a prescribable treatment. It's topical and designed for people suffering from hair loss, working from the outside to support the stem cells that are inside the hair follicle. It reduces inflammation of the hair follicle and gives a better supply of key ingredients for healthy hair growth. We're focusing on, there's a chain of 8 peptides, there's over 150 amino acids, and then there are other organic natural ingredients such as biotin, caffeine, and lots of vitamins. So the mechanism of action of these products is to block the DHT and increase the activity of the telomerase in the stem cells of the hair, i.e. increase mitosis and differentiation to produce new hair growth. We also want to control and decrease inflammation using these products. As we said, that's certainly part of the hair loss problem is inflammation. We want to activate oxyaccident activity, remove free radicals, which we know about the effect free radicals have on the face. It's not really any wonder that the same kind of problem with free radicals can cause hair loss. And we also want to relax blood vessels, and so we can get more oxygen and nutrients flowing to the scalp to stimulate the growth of new hair and thicken hair that's existing. This one I think is particularly impressive. This lady had chemotherapy-induced alopecia, and this was the hair growth that she had after chemo. In this one, obviously, like quite a pronounced bald patch there, and then it's taken from a slightly different angle, but you can see that there's been improvement in the hair regrowth there. So we've got the vials that are for in-clinic use with a derma roller. So you may have seen at the start of the presentation, we had a little video that showed someone derma rolling it onto the scalp and massaging it. So ideally, you would want to do this once a week. However, at the moment, you know, with things the way they are, when we are allowed to reopen, I think everyone will be very busy. So if it stretches to be a treatment every 2 weeks, that's absolutely fine. And actually, it combines really nicely with PRP treatment for hair loss, and you would do them 2 weeks apart.